Well, a virtual greeting to you. My name is Fernando Teswick. I'm Safety Officer for United Regional, and it's my pleasure to welcome you to the organization. And I hope that you ask a lot of questions and that you learn a lot while you're with us at the hospital. I'm going to be going over the environment of care, or basically all the um, non-clinical aspects of the hospital, if you will. The environment of care standards basically are made up of safety, hazards, materials, and waste, emergency management, fire safety, medical equipment, and utilities. And we're going to touch on all those today. Probably as a safety officer, you think, okay, well, the main thing you're probably going to talk about is safety, and that is correct. But safety kind of touches all the different programs because it has to do with hazardous chemicals to keep you from getting hurt, from emergency management, making sure that we have plans available to deal with any kind of emergency, fire safety, how to take care of our patients and staff in case of a fire, medical equipment, um, the very technical pieces of equipment that we work with. How do those get checked to make sure that they're working properly? And then utility systems, stuff we don't think about: floors, walls, ceilings, air conditioning, lighting. How does that stuff all work to support healthcare? And that's important. There's some very easy general safety practices that you can help us with. For example, if you are walking down the hallway and you notice this spill, that's something really easy that you can help us with. If you can't clean it up quickly to prevent slips, trips, and falls. If you can't clean it up, place something on top of the spill. Warn people that are approaching and solicit assistance, and avoid walking on wet floors. One of the biggest types of accidents that we have in the organization are slips, trips, and falls. So if you can help us with that, that would be great. In general, if you see something, say something. A lot of times you kind of think, well, I'm the new person, or I'm just a student. What do I know? That looks wrong, but I'm not sure if it is or not. Let somebody know. Give me a call. My phone number will be at the end of the presentation. Put in a safety event notice, and all those get looked at. Very, very important. We take each report very, very serious. One of the things you'll notice whenever you're walking around the organization is that we have a helipad. That we use it quite a bit on most days to bring patients to the hospital, transfer patients out of the hospital. There's a couple things for you to remember. One, security department is going to prepare the landing site around the perimeter. So you're always going to see security around whenever there's a helicopter taking off landing. Um, Whenever you're approaching a helicopter, so if you're walking up to a helicopter, part of your job, don't come in the front or the back, only come to the sides. Don't walk around tail rotor, the back of the helicopter. Um, Shield your eyes from rotor wash whenever it's landing or taking off. Lots of wind, so make sure that you're very, very careful. If you're carrying anything above your head, watch out, because that stuff can kind of fly away real quickly. Um, don't approach the helicopter until the blades stop turning. Don't cross the street. This is probably one of the most important ones. Whenever a helicopter is taking off and landing, those are high risk times, so make sure that if you can avoid it, don't cross the street, specifically coming towards the helipad. Of course, no smoking anywhere near the aircraft, and know that anything that is loose or not secure, if you're wearing a hat, there's a good possibility that you're going to lose it. So be careful whenever you're walking around the helicopter. Probably another thing that you'll notice whenever you're walking around the organization is that we are on most days having constructions somewhere around the organization. For construction safety, one of the strategies that we utilize to make sure that we're maintaining a safe environment is interim life safety measures. And that's basically 7 administrative actions that whenever we're doing a job, we're making sure that, hey, are we going to take out a fire sprinkler? Are we going to introduce any fire risk into the area? And if we are, then we take a couple of actions to make sure that the space is safe, despite the fact that we're doing construction or we're doing work. If you should be in a space and you see anything that's concerning, you see lots of fire load, you see smoke, you see fire, let somebody know. The construction safety number is 764-7233, and if you call that number, you'll get myself or Jamie, and one of us will come out and take a look at any concerns. Lockout tagout precautions are what we use anytime there's a piece of energized equipment, something that can be turned on with electricity that is not working properly. In facilities, they use it with larger piece of equipment such as electrical panels. Up on the floors, we use it on any type of equipment, pumps, etc., that aren't working properly. The tag basically lets you know that there's something wrong with the equipment and that you shouldn't bring it back into normal use until it's been checked out by biomed. Safety reporting. One of the ways that you can help us in the organization is by reporting any incident you see that you feel is unsafe. What we use is an event reporter that's found on the internet. It's called Verge. And whenever you click on the event reporter, it'll basically walk you through the different processes to report anything from a slip, trip, fall to an unsafe condition, something that you feel needs to be looked at. All those are taken very seriously, and we investigate those within 24 hours of receiving a report. Hazardous chemicals are something that you're going to be working with a lot whenever you're in the hospital. There are going to be a lot of new chemicals and things that you might not be familiar with. If there's something that you haven't worked with before, chemical you haven't worked with before, know that the safety data sheet is available to you. You can find that on the safety page of the internet, and make sure that you look for anything such as PPE that's required, any hazardous material characteristics, if it's a known carcinogen or irritant, that will be found on the safety data sheet, and your process for working with that chemical should be appropriate to the chemical. There are different types of personal protective equipment available to you throughout the hospital. Each one is commensurate with the type of risk. If you're going to be in a patient room and that patient is on some kind of isolation precautions, masks, gloves, goggles will be available at the door. Make sure that you're wearing your PPE. If you're going to be working around chemicals, likewise, they're going to be personal protective equipment that's available to you. If it's made available to you, make sure that you use it and that you know how to use it properly, how to don and doff it correctly. Just as important as PPE are the locations of eye wash stations and other safety equipment in your area. Most importantly, whenever you're working in a new area, make sure that you know where the PPE is located, any safety equipment that is located in the area. And if you do get splashed with some kind of chemical, make sure that you let somebody know and that you wash your affected area, whether it's eyes, hands, etc., for a long period of time with copious water. Whenever you're in the hospital, you're going to encounter lots of different types of hazardous waste. The way that we identify that for staff is by different colors. If you see a red container, that's going to be biohazardous waste. If you see a black container, that's going to be pharmaceutical waste. If you see a yellow container, it's going to be chemo waste. Each one of those wastes is important because they carry different risks and they are to be disposed of in a particular way. So be very, very aware that if you have a chemo waste, it shouldn't be put in a pharmaceutical waste container, or if you have something that has biohazardous materials on it, you don't want to get rid of that in a pharmaceutical waste or a chemo waste container. Be very, very mindful of how you dispose of appropriate waste. Biohazardous waste, or red bag waste, is the biggest category of waste that we have in the organization. Couple of things to remember with biohazardous waste. The hard containers are for sharps. Always assume that waste is infectious and hazardous. Make sure that you only place needles and sharps in the hard plastic containers. Sharps containers should only be 2/3 full, and after that they need to be discarded. Make sure that whenever you're handling waste, you're always wearing your appropriate PPE. Be careful with red bag waste and assume that they contain sharps, and then report any injury to employee health. In emergency management, a lot of what we do is work to assure that we have plans for anything that can happen in the organization. Whenever you get to your floor, you should get one of these. It's a badge, and it basically has a whole bunch of different colors. Each one of those colors is associated with a plan. We're going to go over a couple with you. Code red and code green are the codes that we call overhead if there is any type of fire response. Code green is a fire drill. Code red is an actual fire. The expectation for students is that you notify. So if you see fire smoke in the building, should be in the building, make sure that you let somebody know. Our fire response plan is basically our plan if there's a fire somewhere in the facility. The biggest thing for our students that we ask our students to help with is if there's ever smoke or fire in a building on a floor and you witnesses, pull a fire pole or call 8686. Inclement weather is something that we have routinely in North Texas. Code black can be called for pretty much anything that is not a tornado. We have our own code for tornadoes, but code black can be called for straight line winds, a strong thunderstorm, or anything that could introduce risk to the organization. Code gray is the code that we actually use in case of a tornado. There's a couple of different types of code gray whenever you look at policy. There's code gray watch, code gray warning, code gray take cover. Code gray watch is that the county is under a tornado watch. Code gray warning means that there's a tornado somewhere within the county. Code gray take cover is one that we use in the hospital for whenever we start moving patients to internal spaces. So if you should be here whenever we call a code gray take cover, what we ask of students is to help us to move those patients into safety. Code blue, we use that code whenever there is a patient who is experienced a cardiac arrest or respiratory arrest, and there's a code blue team that responds. Biggest thing to know with the code blue is if you're on a team, go quickly. If not, then you're going to move out of their way to where they can get to the patient as fast as possible. Code light blue is a little bit different. This is one we use for our pediatric patients, and the reason that we differentiate a pediatric patient who is in cardiopulmonary distress is because there's different equipment that is necessary whenever we're responding to one of those codes. Some different portions of departments that are part of environment of care that help the organization to move forward include medical equipment or biomed. If there's a piece of equipment that is not working appropriately, biomed is the department that we call, and those guys have IT support. They have support for individual training for equipment that they utilize to help us make sure that all the equipment that we're using is working appropriately. Utility systems is basically the catch-all of everything in the building that works together to provide patient care. So whenever you think about something as simple as lights turning on, that's our utility or our facilities folks who are making sure that those lights are on, specifically during high-risk procedures. Think about a surgical process where we're performing surgery with a patient. Pretty important that those lights are on. So the facilities folks make sure that the lights stay on, that our generators are working, that the temperature and humidity is correct within the organization in different spaces. So they have a pretty big job to make sure that our hospital is working properly. Maintaining a safety culture at United Regional is very important and one of our priorities. To that end, if you do see something, and let's say you don't have access to a computer, you can call us. My number is 764-SAFE to make it a little bit easier for you to remember. And I'm available. If not myself, Jamie Fairbanks will look at whatever concern you have. And there's no such thing as a silly question or something that we don't care about. We want to make sure that if it's in the organization and it affects our patients, visitors, or staff, that we're looking out for all the systems to ensure patient safety.